the 14-year-old who died in the hospital, she had her 9 night recently. Producer, can you do a follow-up on that story, please?
It's been more than a week since 14-year-old Anna Shea Campbell died at the Spanish Town Hospital in St. Catherine from childbirth-related complications. Wednesday night, the family lit candles at her St. John's Road home in remembrance of her. Hours earlier, senior medical officer at the hospital, Dr. Jacqueline Wright James, revealed that an internal report on what happened is expected to be completed and sent to the Regional Health Authority.
We have a service level agreement that any nocturnal mortality at the level of the institution should be closed within 6 weeks. So that is an agreement that we have, and certainly we are aiming to get all information and bring some closure at the level of the institution within 6 weeks. 6 weeks.
And we're at week what now, if you just can just confirm for me?
Week 1.
Health Minister Dr. Christopher Tufton says the report will be reviewed and actions taken where necessary.
This case represents cases that have to be reported on, and so an autopsy is part of the process to determine cause, and there will be an examination of the case, and depending on what the findings are, whatever corrective action needs to be taken would be taken.
Technical report aside, Dr. Tufton said he was disappointed in the alleged treatment meted out to the teen in her time of distress. Anna's mom, Christine Campbell, accused some of the healthcare workers of being unpleasant towards them. The health minister says the allegations, though not unique to Spanish Town Hospital, are far too many.
Across the health system, there are too many cases where the compassionate component of understanding the grief of our citizens, our patients, is not nearly what it ought to be. And I'm not saying in all cases, but I'm saying in too many cases. And we're going to have to find a way, management that is, to work with the team members within the system, despite the challenges, because there are challenges, I've never denied that. That's why we're working to do some of these things, to improve those situations.
The Ministry of Health's complaint management system has been around since 2000. In 2023, the Spanish Town Hospital was among the top 5 institutions with the most complaints, second to the Kingston Public Hospital. The complaints relate to unprofessionalism, poor quality health care, inadequate treatment, among other issues. And although the complaints represent 1 in every 300,000 patients seen, the ministry says it's still very concerning. TVJ News requested the latest data for 2024. However, we did not receive a response up to news time. The Ministry of Health has committed to providing the data at a later date. Jamila Maitland, TVJ News.
I said, if I heard properly, did they say the report is going to be ready in 6 months' time? Yeah. It's 6 months or 6 weeks?
The autopsy, 6 months. That now come no time soon. But then again, it's an election year and Tuffy want look like him care about something. So yeah. Y'all remember what happened to Jody and Ferron?
Yeah, we remember Jody and Ferron.
Remember Jody and Ferron?
Mm-hmm.
One would think after what happened to Jody and Ferron that wouldn't happen again. But them did say, Tuffy say, ISA shut him out and don't take orders from ISA. And then they gave the case to, anyway, let me leave that alone. The point I'm making is many times, this is a recurring issue in the hospitals. And you have people in the hospitals that have they have very little regard. They have very little regard for people, very little compassion, and they you know this thing that on TikTok, we listen and we don't judge. They do a lot of judging without listening, and I'm saying that we need to change that. But it's the same minister. He was the same health minister when Jody and Ferron died during COVID. You know COVID now, and all him can do is come for a PR thing and talk about, oh, we're investigating the matter. Yeah, and the same person gonna do the thing to ensure that there's no liability. But there is. There is, and people want to be judgmental and conflate issues. But we have a serious healthcare problem, and that's because we don't have a medical doctor manning the system. So he has no idea or concept of how to deal with the breakdowns. For instance, when they were doing the salary package and increases, one would think that the people who save lives would have been properly compensated. But here we are, after salary packages and restructuring, they still have to be striking. Everything is interconnected. And when we talk about causation, but for the incompetence of Christopher Tufton, the young lady would not have been dead. Causation, legally. Yeah.
Why you say Tufton? Why you not say doctor?
Why I say what?
Why you never say the doctors? Why you say Tufton?
No, because the doctors were on strike.
Oh, so you say because of an administration?
Of course. The people who are dealing with your health is bitter. This is as bad. Let me tell you something, and I'm not simplifying it. Context matters. Can you imagine going in KFC and disrespecting the people that serving your food?
Mm-hmm.
And treating them like they are nothing?
Mm-hmm.
Yeah, you get a nice hot twat.
Oh.
Mm-hmm. So always, and so the best thing to do is the people who take care of you is the people you're supposed to take care of first, even financially. And so we have people in the healthcare system that's bitter. Just like when you go to just public and the prime minister come and say, oh, you must do the best at your job. But when it comes to him and him cronies, you get what you pay for. And so we have to increase the salaries so you can get better. It's so fallacious. Mm-hmm. And so nobody should be comforted because, you come and do a press release and the matter is everything in Jamaica is being investigated. Everything is being investigated, but nothing is being done to improve the lives of the people. If you see the conditions at the hospital, I could talk, but they're going to say I'm politicizing. If you see the condition of the road to get to the hospital in Port Antonio.
No, man, you can't say that. The roads are carpets. It is not. The Spark program.
Carpet under who? Carpet under what?
So the Port
them have more hole than carpet down there. Yeah. And them bust some money now so them can patch road and talk about it. But when the next rainfall come, everything gone. Crocodile teeth, skillibeng style. And so they like to talk about investigation and they trivialize the life. Because when I see the mother crying, I can't even laugh about it. Because of the seriousness of it. Because she begged them, as a woman who experienced childbearing, she said, cut her because her vagina small and she can't push it out because she was 14 and the people there just deal with her like she must wait because the doctors were on strike. So then one wonders about the competence of the people, but it's causation. If you were treating the medical people, answering them when they call for a meeting, do what you're supposed to do, the people would be in there and then we wouldn't have this situation. You have other persons who need oxygen and can't get oxygen and them say, so and so. We have a dead baby scandal with him and them say, the dead babies and so and so. And everything is forgiveness.
But then, ever so often, there's a discussion in the space about the high mortality rate amongst mothers and babies. And it is said that the mortality rate of our mothers is even higher than that of the 1980s. We are now in 2024 and you're telling me that we're not dealing with the mortality rate. I want to get back the facts. I don't want to tell any lie. But them said the mortality rate of mothers and babies in Jamaica presently is higher than that of the 1980s. And I am saying we cannot be at that place and space now, and we're not seeing where in which government policies are being strengthened, resources are being equipped, the staff is resourced, they're adequately being compensated. Between you and I in Jamaica, there can be another sick out of the doctors, because to date, the issues with the doctors and the government still has not been rectified. There is ongoing discussion and the doctors are still upset. But how are we going to fix the situation when in which Minister of Health not taking no responsibility, and when civil society come down on him, you have sections and segments of the media who comes to the Minister of Health defense. How do we fix this matter? Mr. Buchanan, you have anything to say about that? How we going to fix this matter?
Fix which matter? Fix which matter?
About the infant mortality rate in the country.
It's the healthcare system that needs to be fixed. There are a lot of persons who are not getting prenatal care. You're just pregnant and you go right through and then you show up to have babies. Yeah, it's a lot of things, but remember, it's twofold, because the mothers die and the child is motherless. But a lot of babies die during birth, and it never was so. So it's made. We're living in abject poverty, See, them are gonna take this part and say the whole of Jamaica poor and the whole of Jamaica in poverty, but we must deal with the conditions as a whole, and it's very, very, very unfortunate. And like I said, there are children raising children, so the midwives are not in the communities anymore, and the fathers who are the fathers are be a Roman boom, so they never even did know them breed nobody. And we don't talk about all the issues, because we take away the prop with the guidance counselors within the schools. You see, every time these things are raised, there's a vetting process that's not happening because Jamaica is just so reactive.
But probably
if this thing was solved when Jordan's mother was advocating and Babsy write her press release and everybody talking, it is 9-day wonders for them. But if this was fixed from pre-COVID, this should never ever happen again. No woman should die in childbirth, especially in that condition. And then when they're ready, the mother didn't properly get not get a lawyer to sign off to make sure that an independent pathologist was there. And then when the investigation is picked, the lawyer them out here, so who them like to talk about government win. Government is gonna win, and them gonna say it's the little girl and it's not the mother. Like how them say is the girl cut off her own hair and not the police cut it. Those kind of conversations, because everything is protect government. Government is there for the people. So everybody's okay. This young lady and her family is a victim of a failing healthcare system. But I'm not the one who should be talking about that. It's Dr. Dawes should come and talk about that. So let me stay in my little lane, because them on my TikTok being disrespectful, and
Stay tuned for more PDTV news evening highlights. Remember to show your support. Comment, like, share, and subscribe. Thank you for watching.